Hello everyone, this is Dr. Nousheen. We are starting with behavior and psychiatric disorder. The first topic is PICA. Okay, the first scenario case is PICA. There is a case of 2-year-old child with anemia. He usually drinks milk. He takes solids in a day very little, and there is a history of passing worms in her stool according to her mother. And her mother is also telling us that he eats dirt while playing. So this is a typical scenario of PICA. However, the medical students listen this, he says this is PICA. But we are start with defining PICA. What is PICA? PICA is eating disorder that is persistent for more than 1 month, eating of ingestion of what? Non-nutritive substance, right? So this is the definition. And what kind of material the child can eat? This is not just dust. It can be clay, it can be sand, stone, pebbles, it can be hairs, feces, it can be like toxics like lead, soaps, laundries. It could be pencils, erasers, fingernails, paper. It could be coal, chalk, wool. It could be burnt matches. Okay, so there is a wires, a lot of things the child can eat, even the plastic, right? So this is a serious behavior problem which leads to significant medical sequelae, right? So what is the cause? The hypothesis, the you can say that it is the nutritional factor, right? It may be because of iron, it may be because of calcium, zinc, or other nutrients like vitamin C, vitamin D. Yeah, this is the cause, but that's not the predominant cause. There is no firm empirical data which support that nutritional deficiency cause PICA, right? The main predominant factor is maternal deprivations, parental separations, parental neglect, the child abuse, insufficient amount of parent-child interaction that's associated with PICA, okay? So the other causes are like malnutrition or hunger. It may lead to PICA, but the main cause is psychosocial root. This is the main cause you need to know, okay? Few things you really need to know that if the medical sequelae when occur, like because of some toxics, like the child can eat heavy metals like lead, which lead to difficult medical sequelae. If the child eats soil-borne pathogens or parasites, it may cause some diseases. And if the child eats something that is like blockage of the gut, okay? Parasitic implications, if you say that it may cause toxocariosis, ascariasis, and parasitic infection like plasmosis, right? It comes from the soil. If the child eats soil, okay, sand, soil, something materials, okay? What about the hairs? If the child eats hairs, it clamp out, it causes gastric ulcer that needs surgical intervention. There is a mastics. The burnt out mastics has, if the child eats too much, it causes hyperkalemia. So these are some sequelae. Lead toxicity, according to how much the child eats, the toxicity will occur. If it's we relate from the GI tract, it may cause constipation, abdominal pain, vomiting, anorexia, diarrhea. And if we talk about neurological manifestations, it may cause a mild irritability, lethargy, ataxia to when we operate, it may cause headache. But with the severity, it may cause cranial nerve paralysis, papillar edema, encephalopathy, seizure, coma, even death, okay? So this is about the lead toxicity with the PICA. Now, what is the intervention you have to do? The first and the foremost, that environment. If there is any toxic substance in child's environment, you need to remove that, okay? Maybe child needs surgical intervention, like in case of bizarre. and maybe it needs medical like lead toxicity. You need some chelations with some uh, uh, you need to chelate the metals. Parasitic infestations, you need some antiprotozoal medications with that. And if there is a nutrition deficit, you need to correct that nutrients. Okay, so this is the one thing which about the cause and the treatment, the ingested material and the treatment. But the main thing is multidisciplinary management approach. We need social workers, physicians, psychologists. This is a combined behavior, social, and medical approach for treating the PICA. So, in a nutshell, when we are going to summarize it, the PICA is serious behavior disorders defined by more than 1 month of non-nutritive ingestion. The nutrition deficiency with iron, zinc, calcium play a role, but psychosocial factors are often predominant, right? You need some sequelae you need to rule out, like lead toxicity. You need to rule out hyperkalemia, parasites, or bezoar, because these things need interventions. Take home message: if you learn from me, do support me. This is the first case scenario for PICA. We will meet in another lecture with another topic. Thank you for listening and understanding. Bye.